Stroke Rehabilitation Assessment of Movement presented by Fanny Vaishnani, Rusty Zala, Denis Avala, Jas Weger, and guided by Dr. Hina Dangarmap.
Introduction. STREAM is a measurement tool used to evaluate the recovery of voluntary movement and mobility post-stroke. STREAM is used to assess patients' coordination, functional mobility, and upper and lower limbs movement. It can be used to track the progression of stroke recovery. STREAM is used in acute, subacute, chronic stage of patient's stroke rehabilitation. STREAM is composed of 30 tasks. STREAM tasks are scored according to voluntary movement of limbs and basic mobility scoring domains.
Scoring System 1 Voluntary Movement of the Limbs. A score of 0 is given if patient is unable to perform the test movement through any appreciable range, includes flicker or slight movement. Score 1 is divided into 3 subcategories. A score of 1A is given if patient is able to perform only part of the movement and with marked deviation from normal pattern. A score of 1B is given if patient is able to perform only part of the movement but in a manner that is comparable to the unaffected side. A score of 1C is given if patient is able to complete the movement but only with marked deviation from normal pattern. A score of 2 is given if patient is able to complete the movement in a manner that is comparable to the unaffected side. Give a cross if activity is not tested and specify the reason. Scoring System 2 Basic Mobility. A score of 0 is given if patient is unable to perform the test activity through any appreciable range. Score 1 is divided into 3 subcategories. A score 1A is given if patient is able to perform only part of the activity independently and requires partial assistance or stabilization to complete with or without an aid and with marked deviation from normal pattern. A score 1B is given if patient is able to perform only part of the activity independently and requires partial assistance or stabilization to complete with or without an aid but with a grossly normal movement pattern. A score 1C is given if patient is able to complete the activity independently with or without an aid but only with marked deviation from normal pattern. A score of 2 is given if patient is able to complete the activity independently with a grossly normal movement pattern but requires an aid. Score of 3 is given if patient is able to complete the activity independently with a grossly normal movement pattern without an aid. Give a cross if activity is not tested and specify the reason.
For task 1 to 6, patient position supine on plinth and therapist position besides the patient.
For task 1 to 3, scoring is given according to voluntary movement of the limbs system. Task 1 Protract scapula in supine. Note: therapist has to stabilize arm with shoulder 90-degree flexed and elbow extended.
Task 1 Protract scapula in supine. Ask patient to please lift your shoulder so that your hand moves towards the ceiling. Task 2 Extends elbow in supine, starting with elbow fully flexed. Note: therapist has to stabilize arm with shoulder 90-degree flexed. Strong associated shoulder extension or abduction is equal to marked deviation. Score 1A or 1C is given. Task 2 Extends elbow in supine, starting with elbow fully flexed. Ask patient to please lift your hand towards the ceiling, straightening your elbow as much as you can. Task 3 Flexes hip and knee in supine. Attains half crook lying position. Task 3 Flexes hip and knee in supine. Ask patient to please bend your hip and knee so that your foot rests flat on the bed. For task 4 to 6, scoring is according to basic mobility scoring system. Task 4 Rolls into side, starting from supine. Note: patient may roll into either side by pulling with arms to turn over. Then score 2 is given. Task 4. Rolls into side. Starting from supine, ask patient to please roll into your side. Task 5. Raises hips of bed in crook line, also known as bridging. Note: therapist may stabilize foot, but if knee pushes strongly into extension with bridging is equal to mark deviation and score 1A or 1C is given. And if requires aid external or from therapist to maintain knees in midline, then score 2 is given. Task 5. Raises hips of bed in crook line. Ask patient to please lift your hips as high as you can. Task 6. Moves from lying supine to sitting with feet on the floor. Note: patient may sit up to either side using any functional and safe method, and it takes longer than 20 seconds is equal to mark deviation and score 1A or 1C is given. And pulling up using bed rail or edge of plinth, then score 2 is given. Task 6. Moves from lying supine to sitting with feet on the floor. Ask patient to please sit up and place your feet on the floor. For task 7 to 21, patient position is sitting. For task 7 to 14, feet are supported and hands are resting on pillow on the lap. Therapist position besides the patient.
For task 7 to 20, score is given according to voluntary movement of limbs scoring system.
Task 7. Shrug shoulder or scapular elevation. Note: both shoulders are shrugged simultaneously. Task 7. Shrug shoulder or scapular elevation. Ask patient to please shrug your shoulders as high as you can. Task 8. Raise hand to touch top of the head. Task 8. Raises hand to touch top of the head. Ask patient to please raise your hand to touch the top of your head. Task 9. Place hand on sacrum. Task 9. Place hand on sacrum. Ask patient to please reach behind your back and as far across towards the other side as you can. Task 10. Raises arm overhead to fullest elevation. Task 10. Raises arm overhead to fullest elevation. Ask patient to please reach your hand as high as you can towards the ceiling.
Task 11. Supinates and pronates forearm with elbow flexed at 90 degrees. Note: movement in one direction only is equal to partial movement and score 1A or 1B is given. Task 11. Supinates and pronates forearm with elbow flexed at 90 degrees. Ask patient to please keeping your elbow bent and close to your side. Then turn your forearm over so that your palm faces up. Then turn your forearm over so that your palm faces down.
Task 12. Closes hand from fully open head position. Note: patient must extend wrist slightly to obtain full marks, and full fist with lack of wrist extension is equal to partial movement and score 1A or 1B is given. Task 12. Closes hand from fully open head position. Ask patient to please make a fist and keeping your thumb on the outside. Task 13. Opens hand from fully closed position. Task 13. Opens hand from fully closed position. Ask patient to please now open your hand. Task 14. Opposes thumb to index finger. Task 14. Opposes thumb to index finger. Ask patient to please make a circle with your thumb and index finger. Task 15. Flexes hip in sitting. Task 15. Flexes hip in sitting. Ask patient to please lift your knee as high as you can. Task 16. Extends knee in sitting. Task 16. Extends knee in sitting. Ask patient to please straighten your knee by lifting your foot up. Task 17. Flexes knee in sitting. Note: start with affected foot forward and heel in line with toes of other foot. Task 17. Flexes knee in sitting. Ask patient to please slide your foot back under you as far as you can. Task 18. Dorsiflexes ankle in sitting. Note: affected foot is placed slightly forward and heel in line with toes of other foot. Task 18. Dorsiflexes ankle in sitting. Ask patient to please keep your heel on the ground and lift your toes. Task 90. Plantar flexes ankle in sitting. Task 90. Plantar flexes ankle in sitting. Ask patient to please keep your toes on the ground and lift your heel. Task 20. Extends knee and dorsiflexes ankle in sitting. Note: extension of knee without dorsiflexion of ankle is equal to partial movement, and score 1A or 1B is given. Task 20. Extends knee and dorsiflexes ankle in sitting. Ask patient to straighten your knee and bring your toes towards you. For task 21, scoring is given according to basic mobility scoring system. Task 21. Raises to standing from sitting. Note: if patient pushing up with hands to stand, then score 2 is given. And asymmetry such as trunk lean, triangle bug position, hip retraction or excessive flexion or extension of the affected knee is equal to mark deviation, and score 1A or 1C is given. Task 21. Raises to standing from sitting. Ask patient to please stand up. Try to take equal weight on both legs. For task 22 to 30, patient position is standing and therapist position besides the patient. For task 22, scoring is given according to basic mobility scoring system. Task 22. Maintains standing for 20 counts. Task 22. Maintains standing for 20 counts. Ask patient to please stand on the spot while I count to 20. For task 23 to 25, scoring is given according to voluntary movement of the limbs scoring system. Task 23. Abducts affected hip with knee extended. Task 23. Abducts affected hip with knee extended. Ask patient to please keep your knee straight and your hips level and raise your leg to the side. Task 24. Flexes affected knee with hip extended. Task 24. Flexes affected knee with hip extended. Ask patient to please keep your hip straight, bend your knee back and bring your heel towards your bottom. Task 25. Dorsiflexes affected ankle with knee extended. Note: affected foot is placed slightly forward in position of a small step and heel in line with toes of other foot. Task 25. Dorsiflexes affected ankle with knee extended. Ask patient to please keep your heel on the ground and lift your toes. Task 26. Places affected foot into first step or stool. Note: returning the foot to the ground is not scored, and use of handrail, then given score is 2. Task 26. Places affected foot into first step or stool. Ask patient to please lift your foot and place it into the first step or stool in front of you. Task 27. Takes 3 steps backward or 1.5 gait cycle. Task 27. Takes 3 steps backward. Ask patient to take 3 average size steps backwards and placing one foot behind the other. Task 28 takes 3 steps sideways to affected side. Task 28 takes 3 steps sideways to affected side. Ask patient to take 3 average side steps sideways towards your weak side. Task 29 walks 10 meters indoors. Note, if orthotic is used, then score 2 is given. And if it takes longer than 20 seconds is equal to mark deviation and score 1C is given. Task 29 walks 10 meters indoors. Ask patient to please walk in straight line between one mark point to another mark point. Task 13 walks down 3 stairs alternating feet. Note, if handrail is used, then given score is 2. If patient is unable to place alternate foot, then is equal to mark deviation and score 1A or 1C is given. Task 13 walks down 3 stairs alternating feet. Ask patient to please walk down 3 stairs and place only one foot at a time on each step if you can.